What if the quietest whispers from your body are the ones you need to hear the most? I am not talking about a sudden, dramatic event, but those small, nagging feelings you might brush off as just getting older or being a little tired, a strange flutter in your chest while you are reading, or a moment of dizziness that passes as quickly as it came. These seemingly minor signals are often the very first words in a story your heart is trying to tell you. A story about needing a little more support. Today, we are going to learn how to listen to that story. To understand those subtle clues before they become a shout, because paying attention now could change everything. It often starts with a feeling of profound exhaustion, a deep, bone-weary fatigue that a good night's sleep just can't seem to fix. You might feel drained after simple tasks that used to be easy, like carrying groceries or folding laundry. This isn't just normal tiredness. It is your body signaling that it is running on low fuel because your heart isn't pumping enough oxygen-rich blood to your muscles and organs. To compensate, your heart starts working overtime, like an engine stuck in high gear. That is why you might feel your heart racing or pounding in your chest for no reason, even when you are sitting perfectly still. A resting heart rate that is consistently over 100 beats per minute is your heart telling you it is struggling to keep up. And that same struggle to pump blood efficiently can show up in some surprising places. Have you noticed your hands and feet feeling icy cold, even when the rest of you is warm? Your body is smart. In a pinch, it prioritizes sending blood to your vital organs, like your brain and heart, leaving less for your extremities. This is why your fingers and toes might feel chilly or even numb. But even the brain can feel the effects when it doesn't get a steady supply of oxygen. You might experience a kind of mental fog. Suddenly, you are struggling to find the right word, forgetting why you walked into a room, or finding it hard to follow a conversation. It is not just absent-mindedness. It can be a direct result of reduced blood flow to your brain. When your heart can't pump effectively, it is not just about where the blood is going. It is also about where it gets stuck. Think of it like a traffic jam. Blood can back up in the veins, forcing fluid to leak out into your body's tissues. When this happens in your lungs, you start feeling short of breath from the slightest effort. Like walking to the mailbox, it might get worse when you bend over to tie your shoes, a surprisingly specific clue called bendopnea, at night. This fluid can make it feel impossible to breathe while lying flat, forcing you to prop yourself up with pillows just to get comfortable. You might even develop a persistent dry cough or a wheeze that won't go away, which is your lungs reacting to that extra fluid. This fluid doesn't just stay in your lungs, it often travels downwards due to gravity by the end of the day. You might notice your socks leaving deep imprints on your ankles, or your shoes feeling uncomfortably tight. That swelling in your feet and legs is a classic sign of fluid retention. You might also see it on the scale. A sudden weight gain of 2 or 3 pounds overnight isn't fat. It is your body holding on to water. This fluid can even build up in your abdomen, making you feel bloated or full after only a few bites of food. Sometimes even causing you to lose your appetite altogether. And as your body tries to manage all this extra fluid, your kidneys may work overtime at night, causing you to wake up again and again to use the bathroom. All these signs, the swelling, the weight gain, the nighttime trips to the bathroom, are part of the same story. Your body is trying to deal with a plumbing problem that starts right in your chest. At times, a simple act like standing up too quickly can cause the room to spin, as your heart struggles to adjust and get enough blood to your brain, leaving you dizzy and lightheaded. Each of these signals, from cold feet to a nagging cough, from a foggy mind to swollen ankles, may seem small on its own. But when you see them as connected chapters in a single narrative, the message becomes clear. These are not just random annoyances of aging. They are your body's heartfelt plea for help. The beautiful thing is, your body is giving you their chance to listen early. Recognizing these whispers for what they are is the first, most powerful step you can take. It is not about fear. It is about respect for the incredible work your heart does every single day. By paying attention and talking to a doctor about what you are noticing, you can begin to give your heart the support it is asking for, ensuring it can continue carrying you through all the moments of your life, both big and small, We love hearing from you. So please leave a comment below. We read and respond to every single one with helpful insights. If this video brought you clarity or a sense of hope, please give it a like, share it with a loved one, and make sure to subscribe for more.